First, this is Lana again, veterinarian pharmacist. Today I'm going to be with my cat. My cat, her name is Nurka. It's a common Russian name. And she's an unusual cat. She's very pretty, very gentle, but unusual just because she has only 3 legs. Yes. And not because she was born this way. No, she lost her leg when she was very little, tiny little baby, and got run over by car, I believe. So anyway, it was a really bad accident, and she's with us already for about 12 years. So she's doesn't have any signs of aging. She's very fast, very normal cat, very active, and eats very good. She's very picky about her food. But today we're going to be discussing the topic feline hyperthyroidism. That's a common disorder in the cats, especially in older cats. And sometimes it's hard to tell that pet has this disorder because it just mimics aging, normal aging sign. Unfortunately, without treatment, feline hyperthyroidism can progress to morbidity and even death. So, but the prognosis is very good if animal adherent to medication. So of course pet owners has to really be really patient with that and give pet medicine every day for thyroid disorder. And if it's any complication like thyroid carcinoma, yeah, prognosis is not very unfortunately not very good. So what is it, hypothyroidism? It is when glands secrete too much hormone T4 and T3. Thyroxine T4 and 3-OD-thyronine, it's T3. So it's more common in cats than hypo, which is low secretion. But treatment option of medication, obviously, and radioactive iodine ablation of thyroid. And radioactive ablation of thyroid can be done only in veterinarian offices, so you have to contact your veterinarian regarding this treatment. As far as medication, a very common medication, it's methimazole. So it's approved for treatment feline hypothyroidism, or it's called methimazole or felmazole. It's effective, very small tablet, white color, round white color, 2.5 milligrams or 5 milligrams. So usually daily dose every 12 hours or once a day. Yes, Murka, it doesn't take any medication, and she's kind of nervous a little bit, scratching me everywhere. Calm down. Yeah, and she has a really sharp claws. So many pet owners are unable to manage administration of methimazole tablets. So pharmacists, when they receive prescriptions, they can compound either liquid or transdermal gel dosage form. Liquid is much easier to administer using a little small syringe or like a little dropper, and just stick in the mouth, because when you give her a tablet, she can spit it out. Transdermal patch is most often compounded in concentrations ranging from 1 to 0.5 milligram per 0.1 ml. So which is approximately, depending on weight, it's going to be about 1 ml, very small dosage of administration of this medication. So also I want to mention about the side effects of this medication. So the most common side effects of this therapy: anorexia, vomiting, a little bit loose stool possibly. So please administer it with food to diminish the side effects. If something severe, obviously contact your veterinarian, and he can stop this medication or change or lower the dose or change to something else. Usually, the signs of hypothyroidism in cats or feline patient. It is nausea, vomiting, diarrhea, polydipsia, tachycardia, hyperactivity, especially at night when they go out, and also expressing themselves really vocally, losing hair. It's even damage the nails or clothes. I'm sorry. So anyway, that's kind of watch for the side effect. If you notice unusual weight loss and unusual thirst in the animal, diarrhea, vomiting, so contact your veterinarian. It's possibly that's what it is, hyperthyroidism. Another medication is called carbimazole. Carbimazole is prodrug of metimazole, kind of like drug that converts in the body to form of metimazole. It's not approved in the United States, but in other countries it is approved, and that's why we not really was the doctors not prescribe this medication in the United States. So very important to see a doctor once in a while, because you need to check if that medication is really working, and do laboratory tests, obviously, to see where the level of thyroid are. And when you put in the transdermal gel of metimazole, use a glass. Also, you can put a metimazole in the ear and kind of rubbing this gel inside the ear. Do not refrigerate this gel, just keep it at room temperature. If you see something like irritation or rash on the ears, whatever you administer, so that's you gotta contact to veterinarian immediately. That's about it for today. So, like again, I was gonna show you where you can put this gel right here inside the ear in the pad, oral solution. I usually open up a little bit. They don't like too much. A little bit, like this. And just stick very quick syringe with a medication. That helps. Some people manage just to stick tablet with a little bit treat in it. It also works pretty well. All right, I'll see you next time. Thank you so much for listening. I'll be back with more topics about my favorite pets and all pets any kind of disorder or diseases, the common diseases that pets develop. Thank you so much. You have a great day. Bye-bye.